Kim and I welcome you to our webinar, Sidelined During COVID-19, a narrative inquiry into how simulationists experience the pandemic. Kim and I could not have done this research without the extreme help, really the guidance of Dr. Gabe Reedy and Dr. Anna Jones, who led us through the use of narrative inquiry. Both of them have much more experience in this line of research than we do. And both of them were trapped in countries other than their own for a large part of the pandemic. Anna was in Australia, although she lives in England, and Gabe was in France, although he lives in England. So thank you so much to both of them for the work that they did to help us out and guided us through the whole research process of narrative inquiry.
So let me tell you how this study came to be. Now, when COVID first started, my sim center was shut down. There was no discussion about it at all. And I had to send all of our supplies and equipment, linen carts, trash cans, everything to our new field hospitals. And so trying to navigate that from home, because I was over 55, so I was deemed too old to actually go into work, which was fascinating. Got to the point very quickly where I was putting virtual animals on my computer. I had a lion laying on the couch, and I had a panther on the living room carpet. But at the same time, I felt so guilty because I was an ER nurse for my whole career. And I felt like I should just put on a pair of scrubs and I should go over to the ER and just start working. But honestly, I was glad I didn't have to do that. So that just created this moral dilemma for me. And I really struggled with this a lot. And so I called Susie and I said, I have an idea, but I need you to talk me out of it. And she'll laugh because she says, no, I'm not going to talk you out of it because it's something that we should do. But, the premise was I knew that I couldn't be the only one feeling this way. And so we wondered what was happening to other simulationists and in their environments, and how did they feel about the experience that they were having? We decided to create a qualitative research study with the help of Gabe and Anna, and look at the experiences of our peers in the simulation community who had licenses, but did not provide direct patient care during the initial pandemic response. And we called these people sidelined. So defined as a person who observes an activity or situation, but cannot directly participate in it. And for whatever reason or another, we were interested in hearing their stories.
So for doing this narrative inquiry in the middle of a pandemic, we used a survey software called Phonic out of San Francisco. It had one open-ended question, which you see here, plus 4 demographic questions regarding the respondent's background and years in simulation. We advertised our study on simulation websites, both in Axel and SSH, and internet sites, including Facebook and LinkedIn. Anyone who thinks that qualitative research is simpler than quantitative research hasn't done qualitative research. There's a lot of reading, rereading, and then some more reading, pondering, coding, going away for a couple days, coming back, reading, rereading, recoding, arguing among yourselves, arguing with yourself, and then coming up with what you really believe the themes of the research appear to be. After you have done that initial kind of work when you're using narrative inquiry, we pick a couple of the people who participated who in their narrative basically give us a broad range of emotions that exhibit all of the themes that were discovered within the narrative inquiry that we did. So we include in our article probably 4 or 5 narrative arcs because they were so interesting, but we include only one in this presentation. Here's a sample narrative arc, and I'm just going to be quiet and let you read this, and then I'll comment again at the end. And we see from this that we really see that people are really processing why they don't want to participate during COVID, because again, we still didn't know a whole lot about it. And I don't think at this time Delta had reared its ugly head yet. And that they also wanted to go, and that they would have gone if they had thought that they really needed to go, or it was a desperate situation. So again, this is a fairly common theme that appeared in our research.
When we analyzed the data, we came away with two major themes. One was challenges and the other was opportunities. For challenges, we heard a lot of stories about guilt, frustration, being overwhelmed and stressed and exhausted, being away from the action, being unused and underappreciated as simulationists. But others told us about ways that they had adapted to these challenges. Many of the respondents talked about feeling guilty for a lot of different reasons, like lack of frontline involvement, not wanting to be on the front line, worrying about their peers. You know, they all had fellow nurses and friends that were on the front line, stressed, overworked, scared, and exhausted, but they felt lost and helpless and guilty because they weren't out there on the front lines helping their peers. Even those who didn't volunteer because of risk due to age or health status felt really badly about that, you know, to the point of reporting feeling worthlessness, and that not being able to help just made that feeling worse. The others were concerned about newly trained clinicians, their new graduates that got released out into the pandemic. And did they know how to handle that? Many respondents expressed frustration. They were frustrated because they were losing their jobs. They were being furloughed. When they did want to apply for frontline jobs, they were turned down. You know, one person said that in their current work as an academic and simulationist, they just felt useless. Another was frustrated. They wanted to be on the front line, but because of their family and the job that they already had, they needed to stay where they were, but they were frustrated they couldn't help more. Somebody else said that their workload had at least tripled, but they still felt helpless as a nurse or a practitioner. Now, one said that the experience that they were able to provide to students since COVID-19 has been valuable, but they really wish they could have done more. Many reported feeling overwhelmed, stressed, and exhausted. It was a challenge to manage the environment that we were working in. We had anxious staff, and our families were anxious. Nobody knew what was happening at the beginning of the pandemic. We were all anxious. We were overwhelmed and stressed because there was just this lack of cohesive response as to what we were supposed to be doing to keep safe. And then at the same time, we had to create new plans and deal with numerous different problems. So some reported that initially it was very anxious and a lot of anxiety about COVID and just making sure that we got things right. One felt uncertain if they were doing their best by the students. They felt that they really tried, but just wondered if it would be enough. And they were concerned about patient safety. Some expressed stress, not knowing what they could do to support the nurses and the other members of the healthcare team who were on the front lines. But at the same time, they also felt unsupported, and that made them feel sad and overwhelmed. Another person reported they just felt overwhelmed by dealing with the pandemic at large, not so much overwhelmed by their work. because they had to adjust to that, but it was just dealing with the pandemic itself that was too much. Now, while some felt overwhelmed and stressed and exhausted, others reported feeling energized and rewarded and realized that their work was important. So, as one respondent said, I just felt truly, as exhausting as it was, I felt truly energized to be able to help others come up with a workable plan that was successful and still helping our students meet the outcomes for their course. Another said that now they realized that what they were doing was very important and more important than their previous job. They were training teacher frontline workers to be safe and helping to continue the supply of those needed workers. So as tiring and as exhausting as it was very rewarding to be able to get those resources together and get them out there for the students and hospital staff to use. For some, they were away from the action. There was no personal involvement in the clinical response, even if they wanted to. So, some people tried to get jobs where they could work on the front lines, but they were unable to. People weren't hiring. Travel nursing agencies were filling in the gaps. And, if you remember back at the beginning, there were a lot of very large pockets across the country and the world where there weren't COVID patients. So while places like New York City were inundated and needed dramatic help, there were other parts of the country that weren't seeing any COVID patients at all. So one of the interesting responses was that, they had to balance this line between getting people prepared and managing their anxiety for an event that wasn't really happening for them. Now, one of the respondents said, I've offered to work clinically. However, our local hospitals don't need the help. I wish my simulation expertise could be used to prepare local clinicians for COVID-19 procedures, such as protected intubation, but that opportunity is not available for me. Some respondents reported feeling unused and underappreciated. There were many missed opportunities reported by these folks, and the education they were wanting to do wasn't appreciated. The sim team was underutilized, and training was just basically to check a box and not really to ensure readiness for safe patient care. As one person said, they're hospital-based, and they have not embraced what simulation is as it compares to education and training. And that frustrated that person more than anything, because they believed that COVID training was the opportune time to incorporate simulation experiences. But because it wasn't understood in their environment, it was just a missed opportunity. And we heard that in several of the responses. Here's another one, that they don't believe that they fully understood what simulation was capable of. Others, professors abandoned their standardized patient simulations when the pandemic started, but then they turned around a month or two later and decided, oh, we want to do this. And some professors actually increased standardized patient simulation. As we know, there was a lot of that done via Zoom that allowed it to be done safely. Someone else noted that within their department, she or he was the only one that had any expertise in education and especially simulation. So they weren't really in a position to make a difference. She or he used subtle suggestions and used their debriefing skills to try to get their leadership to have great ideas. But unfortunately, they weren't supported. Some of the respondents adapted well. Despite the challenges, they shared how they had adapted and what they had learned from those challenges. So they said what they learned most was that the students adapt, and you learn the details of how and what they're learning, and then you can change your processes, but mostly because you have to in the pandemic. Now, many of the adaptations and coping strategies were positive, although one respondent did comment that they were drinking a lot of coffee to pick up in the beginning of the morning, and they were drinking a lot of wine at the end of the day. And others sought new opportunities to learn and network within the simulation community. So we had great opportunities with different webinars and virtual conferences these last couple of years.
To our great surprise, although we thought we were only going to have people respond to us that were talking about feeling sidelined during COVID, we had a group of people who responded that they were exhilarated by the experience and were busy using simulation in new ways. Simulation had suddenly become an important part of a hospital or of an educational enterprise, and they were just having a wonderful time and practicing at the top of their game during COVID. So we didn't know this was going to happen, and we ended up finding themes that were involved in the opportunities presented by COVID. They included things, two variations on leadership, both an evolution of simulation within an organization and innovations using simulation. Also, there were people who had great opportunities for personal development, oftentimes because they were let go by their organizations, or that they really felt they were part of something bigger than themselves and maybe bigger than their organization during COVID. This is a great example. We have two great quotes here about evolution in the leadership. And when you know that many of us thought that there would be no way you could ever do video validation of skills, and yet people found ways to do this. Another thing that happened was that faculty released some of their sacred cows, started knowing that in crisis there is opportunity and that they were going to get creative and thought about different ways to educate their students. What we hope is that we don't backslide now that the worst of the COVID is over with. So what we found under innovation and leadership was that simulation might have played a minor role in a hospital or in an academic center pre-COVID, but what happened is sometimes the simulationists were the only people left on the campus. They were busy doing all kinds of education for everybody, or continuing clinicals in one way or another and coming up with creative ways to do it. So read the different things here, and I will say that when you read the article, you'll find that so many interesting things came out of when people were able to talk about what they were doing during the pandemic. Some people really experienced personal growth and probably were forced into leadership positions that they did not know they would ever have or that they thought they could do. So I love our first quote here. I was given the task of creating a 12-hour virtual clinical experience. I felt accomplished. The plan worked. It was pretty awesome. And people figure out how to use Zoom for all kinds of things. They pivoted. They quickly learned how to do new things. And other people learned to maybe step away from their current line of work, whatever it was, and developed new professional opportunities for themselves. They did freelance work. They went to other simulation centers and helped them get up and running. All kinds of interesting stories developed over in this particular theme. Being a part of something covered, again, a wide range of stories, and you can see some of them here. I really like the fact that a dental lab put people through 4 and 5 procedures in full PPE, and that they really felt like there was no time wasted and that people learned a whole lot really fast. And that was just wonderful to see. The other thing that was really interesting, this probably happened overseas, is that they had to develop training materials in all kinds of different languages, and that simulation was used for the cleaning staff, for janitors, for people who gave out food trays, et cetera, et cetera. Simulation was also used for testing all of the respirators through technical tests and then giving them out to clinical staff. So again, we had many different wonderful stories about being a part of something bigger than themselves, bigger than the sim lab, and really part of being in a global effort to combat what was going on. So many of us are really skilled at explaining our feelings because we work in healthcare. And what we saw over and over again was a tension between a really positive thing and a really negative thing. And people were able to hold both of these feelings within themselves and share them in their narrative arcs. So people were almost like self-reflecting as they went through their experiences of COVID, and those come out in the narratives that we included in the articles. And these are just some of the juxtapositions that you'll see and be very aware of as you read the article. So we come down to the so what. And this particular study was a snapshot in time. It documented different people's simulationist experiences of COVID in multiple countries around the world, mostly in the United States and in the Western countries, although some in the Middle East, some in one in Australia. It allows us to really consider that when we talk about the pandemic a few years from now, that there are people who had an exhilarating experience during this time and people who had a very dismaying and disheartening experience during this time. And we want to be mindful that people had different experiences during COVID, and that those emotions that people experienced were either great or terrible, and that we want to be mindful of that when we have these kinds of discussions. What is of great interest to me is that we're really talking about mental health resources now more than we ever have, not only for our patients and our communities, but for healthcare workers. Within the last 3 days, in 2 very different places in which I work, I have had an opportunity to learn about and sign up for and become a mental health first aid worker. And this is a program that is now out there. If you're a healthcare provider, I've already been through the on-screen part of the training. I will say that it's nothing that we don't know, but the 8 hours of didactic will give, or 8 hours of practical experience will give you an opportunity to try out what they have taught you in the didactic. So it's simulating. So nothing that we don't know, but it's interesting that this is coming to the fore, and this is something that you might be interested with your students also, or your other co-workers. If we have enticed you to read our paper, here's a QR code that takes you directly to it. It is open access, so when you click on this, you will get the paper in your hand immediately. Thank you very much. And here are both Kim and my contact information. Thank you for listening.